Hi, I'm Dr. Tara Miner. I'm an educator at Vanderbilt University Medical Center in the Department of Pediatrics in the residency and fellowship programs.
And I'm Dr. Rachel Good. I'm a developmental behavioral pediatrician at Vanderbilt University Medical Center. And we're here today to tell you about our article, All on the Same Team, Simulated Learning to Introduce Pediatric Residents to Interprofessional Collaboration with Individualized Education Program, or IEP, teams.
So before I came to Vanderbilt, I taught high school English for a number of years. And in speaking to our pediatricians and our pediatric residents, noticed that there was a real gap in their knowledge about special education law, resources, and the processes that happened in schools to secure these supports for students.
And as a DBP, I understand that we have little time to devote to instruction on this topic in medical school. And it really depends on your residency program as to how much instruction you get on this topic as a resident. And so this became a collaboration between the two of us as to how we could best teach these concepts to our pediatric residents before they graduate our program, and how they could learn that they are part of this team as well.
So we focused in on reconceptualizing the Individualized Education Program team. So the IEP team is the interprofessional school-based team that decides the supports and goals for students who are receiving special education. And we thought, what if we reconceptualize this not only as an interprofessional team, which it already is, but to an interprofessional healthcare team, and that widens its influence outside of the school walls to include the pediatrician as a member of that team. And pediatricians could participate on IEP teams in one of three ways. One, although this may happen rarely, they could participate directly. They could attend IEP meetings and give their input as the school decides on the supports the child will receive. Second, they could participate indirectly by providing information to the schools as they make their decisions on the supports the child will receive. Or third, they could counsel parents and caregivers on their rights and resources available to them as they work with schools on on developing the supports that their child will receive. So what we did to help pediatric residents think about the IEP team as an interprofessional healthcare team was to develop a 30-minute simulated eligibility meeting, an IEP eligibility meeting. And we decided on simulation because it has a track record of being an effective educational tool in the health professions, and it avoided scheduling conflicts with schools.
And upon further investigating into the literature, we didn't see that this has been done using simulation to teach an interprofessional healthcare system within the school and a medical professional. So that was kind of exciting for us too. So as Dr. Miner said, we put together a 30-minute simulation for a 4th grade child who has a specific learning disorder in reading. And we worked with the Simulation Center here at Vanderbilt and their faculty and their staff members so that the physician or the medical resident plays the role of a physician, and then the actors play other roles of people within the IEP team, such as the psychologist, the teacher, the administrator, and the parent. And the goal was that we were measuring the residents' change in their beliefs and attitudes towards the interprofessional healthcare team and how they play a role. And we did this by using the interprofessional socialization and valuing scale, or the ISVS, short forms A and B. And with this tool, we found that the residents did see a positive change in how they viewed themselves as part of the interprofessional healthcare team.
So residents learn not only to view the IEP team as an interprofessional healthcare team, but to recognize that they had a role to play on that team. And this is really exciting because by using this scaffold, by conceptualizing the IEP team as an interprofessional team, this can help us teach special education law and resources to pediatric residents as they prepare to help parents in this process. And overall, we're very excited by the promising results of our study that help show pediatric residents that they and school personnel are all on the same team. So for more information and an outline of our simulation, please read our article.
Thank you.